Have you ever wondered why your legs feel weaker, even though you're maintaining all your healthy habits? Just imagine, you've always been mindful of your diet, exercised regularly, gotten enough sleep, and yet you gradually feel your legs losing strength. Have you ever considered that the culprit might be precisely what you're consuming, believing it to be the healthiest thing? I have a revelation that will surprise you. That apple you eat every morning thinking it's good for your health might be literally robbing you of your strength day after day. And it's not just apples. Many of the fruits we've always been taught to consider superfoods may be turning into silent saboteurs of your mobility after 60. The most alarming thing? This process happens so gradually that by the time the symptoms become obvious, like difficulty climbing stairs, heavy legs, or imbalance when walking, muscle weakening is already at an advanced stage. And the worst part? Doctors rarely make the connection between your healthy diet and these problems. Today, I'm going to reveal the 7 most dangerous fruits for the health of your legs after 60. And more importantly, I'll show you how to replace them with alternatives that truly strengthen your muscles and ensure your independence. This may be the most valuable information you receive this year about your health. Dr. Alexander King, transforming scientific knowledge into quality of life for you. Before revealing which fruits are problematic, we need to understand why something seemingly so healthy can become harmful after 60. The answer lies in the profound changes our metabolism undergoes with aging. After 60, our bodies go through significant transformations. The liver's ability to process sugars decreases by up to 40%. Our kidneys filter substances more slowly, and our digestive system absorbs nutrients differently. What few doctors explain is that these changes completely transform the way we process certain foods, especially fruits rich in certain types of sugars. Fructans and fructose present in high concentrations in certain fruits become true villains for the mature body. When consumed in excess, these sugars overload the liver and initiate an inflammatory cascade that directly affects the joints and muscles of the legs. A study conducted by the University of California, Los Angeles, UCLA, followed FAS 200 adults over 65 for 5 years. The results were striking. Those who consumed large amounts of the fruits I'm about to mention had systemic inflammation levels 31% higher and muscle strength loss 23% faster than the control group. This inflammation directly affects muscle tissue and joints, creating a vicious cycle. Inflammation generates pain. Pain reduces movement. Less movement causes more weakness, and more weakness results in greater dependence. It's a devastating domino effect that begins with seemingly harmless choices in your diet. Have you ever noticed that your leg pain worsens on certain days for no apparent reason? Have you ever noticed that you sometimes wake up with heavier legs, even without having exerted yourself the day before? These may be the first clues to this inflammatory process. Now let's get to the revelation that can completely change your health. These are the 7 fruits that most compromise the strength of your legs after 60. This sugar spike triggers an inflammatory response that directly affects muscle tissue. In addition, the specific type of carbohydrate present in bananas can worsen intestinal absorption problems common in older adults. Grapes. Surprisingly, grapes contain one of the highest concentrations of sugar among all fruits. A single cup of grapes contains approximately 15 grams of sugar, which for the slower metabolism after 60 represents a significant overload. Studies have shown that regular consumption of grapes is associated with increased joint stiffness and reduced muscle recovery capacity. Mango. Rich in fructose, mangoes cause one of the biggest impacts on blood sugar among all tropical fruits. The problem is that after 60, our body processes fructose much less efficiently, converting it into compounds that promote inflammation in the joints of the hips, knees, and ankles. An average mango contains about 30 grams of sugar. Watermelon. Despite being hydrating, watermelon has an extremely high glycemic index, which means it raises blood sugar quickly. This glucose spike, when frequent, damages the small blood vessels that nourish the muscles of the legs, reducing the flow of essential nutrients for muscle regeneration. Pineapple contains bromelain, an enzyme that many consider anti-inflammatory. However, in people over 60 with increased sensitivity, this same enzyme can trigger inflammatory responses in muscle tissue. In addition, its high sugar content, about 16 g per slice, overloads the slower metabolism. Orange, although famous for vitamin C, oranges contain citric acids that, in older people, can increase the acidity of the body, creating an environment conducive to chronic inflammation that directly affects muscle health. Frequent consumption of oranges has been associated with increased joint sensitivity in studies with older adults. Apple contains high levels of fructose, which in the metabolism of people over 60 can be converted into uric acid, one of the main villains of joint health. The accumulation of uric acid causes microcrystals that irritate the joints, causing pain and reduced mobility. Have you noticed that your leg pain seems to worsen on certain days after eating some of these fruits? Have you noticed that swelling in your legs increases when you consume more of these fruits in your diet? This is no coincidence. How do you know if these fruits are really affecting your health? There are clear signs you should watch for. Next comes morning stiffness. If you have difficulty moving your legs when you wake up, and this worsens on days when you have consumed any of these fruits, this may be a clear sign of the connection. The third sign is localized swelling, mainly in the ankles and lower legs. This swelling tends to be more pronounced at the end of the day and is directly linked to the inflammatory response triggered by the sugars in these fruits. Pain when climbing stairs or getting up from a seated position is another strong indicator. This pain is often described as a burning or tingling sensation in the muscles of the thigh and calf. Finally, a decrease in the distance you can walk without discomfort. If you used to walk easily for 30 minutes and now need to stop to rest after 15 minutes, this may be directly related to the inflammation caused by these fruits. The story of Mary S., 72, perfectly illustrates this problem. For years, she religiously ate 2 apples and an orange every day, believing she was taking care of her health. Gradually, she began to feel weakness in her legs and difficulty climbing the 2 flights of stairs to her apartment. After removing these fruits from her diet for just 3 weeks, the difference was impressive. The pain decreased significantly, and her walking endurance increased by more than 40%. Have you ever tried eliminating any of these fruits from your diet for a few weeks? Have you noticed any difference in the strength and energy of your legs? Now that you know what to avoid, let's talk about the fruits that can really strengthen your legs and improve your mobility after 60. Berries, strawberries, blackberries, raspberries, blueberries are your greatest allies. Rich in anthocyanins, substances with a powerful anti-inflammatory effect, these fruits directly combat inflammation in the joints and muscle tissues. A study from the University of Michigan showed that regular consumption of blueberries reduced inflammatory markers in older adults by up to 25% in just 6 weeks. Avocado, technically a fruit, is extremely beneficial. Rich in healthy fats and low in sugars, it provides sustainable energy for the muscles without causing glucose spikes. It also contains compounds that strengthen the walls of blood vessels, improving circulation in the legs. Ripe papaya contains natural digestive enzymes that reduce systemic inflammation and improve the absorption of essential nutrients for muscle health. A study with 85 participants over 65 showed that regular consumption of papaya increased muscle strength by 17% after 3 months. Kiwi, in addition to having a low glycemic index, is rich in vitamin C and antioxidants that protect muscle cells from oxidative stress, one of the main factors in age-related muscle weakening. Cherries, especially tart cherries, are known to reduce uric acid levels in the body, reducing inflammation in the joints and facilitating movement. Fresh coconut, with its low sugar content and high content of medium-chain fats, provides clean energy for the muscles without overloading the metabolism. The medium-chain triglycerides present in coconut are converted directly into energy by the muscles, improving physical performance. Stewed pears, without the peel, are an excellent option for those who miss the sweet taste. The cooking process breaks down some of the sugars and reduces their impact on blood sugar, making it safer for consumption after 60. The secret lies not only in choosing the right fruits, but also in how to consume them. Always combine fruits with a source of protein or good fat, such as plain yogurt, cottage cheese, or nuts, to reduce the impact of sugars on your body. Mr. Carl 75 is an inspiring example. After replacing his 2 daily apples with a handful of blueberries with yogurt in the morning and half an avocado at lunch, he experienced a remarkable transformation in just 45 days. The chronic pain in his knees decreased dramatically, and he returned to playing buckyball 3 times a week, an activity he had abandoned due to the pain. Have you included any of these beneficial fruits in your daily diet? Have you been able to notice any improvement in your energy and muscle strength? Now I will share with you a practical 21-day plan to eliminate harmful fruits and gradually introduce beneficial fruits into your diet. This period is ideal because it allows your body to completely detoxify and begin to experience the benefits of the new choices. Week 1. Gradual elimination. In the first 7 days, reduce the consumption of problematic fruits by half. If you eat an apple every day, start consuming it only every other day. Introduce a daily serving of berries, preferably at breakfast. In this first week, keep a simple diary, noting how your legs feel when you wake up and at the end of the day. Pay special attention to weight, stiffness, and any discomfort. Many people already start to notice small differences at this stage. Week 2, complete replacement. In the second week, completely eliminate the 7 problematic fruits and replace them with healthy alternatives. Consume a daily serving of berries and alternate between avocado, papaya, and kiwi at other times. Also, add a simple exercise. Sitting in a sturdy chair, extend one leg until it is parallel to the floor, hold for 5 seconds, and lower. Repeat 10 times with each leg twice a day. This simple exercise, combined with the new diet, will accelerate the recovery of muscle strength. Week 3. Consolidation and evaluation. In the third week, maintain the eating pattern from the previous week and carefully observe the changes. Most people report a significant reduction in the feeling of heaviness in the legs, greater ease when climbing stairs, and decreased swelling in the ankles. Increase the chair exercise to 15 repetitions per leg, 3 times a day. Also, if possible, include short 10-minute walks after meals, which will help control blood sugar and strengthen leg muscles. At the end of the 21 days, do a complete assessment. Compare how your legs felt before and after. Most people experience a 40% to 60% reduction in discomfort symptoms and a noticeable increase in leg strength and endurance. Lucy S. Mewarnel, who I mentioned at the beginning, followed this exact plan. After 21 days, she not only regained her ability to climb stairs without pain, but also returned to walking 30 minutes in the morning without feeling heavy legs. At 68 years old, she regained the independence she was gradually losing. Would you be willing to try this plan for 21 days to discover how your legs can strengthen? Can you imagine what it would be like to return to performing your daily activities without pain or limitations? We've reached the end of this eye-opening content about the 7 fruits that may be hindering the strength of your legs after 60. Let's recap the main points we covered. These fruits can trigger inflammatory processes that directly affect the strength and mobility of the legs. We learned to recognize the signs that these fruits are negatively affecting our health. Feeling of heaviness in the legs, morning stiffness, swelling in the ankles, pain when climbing stairs, and decreased walking endurance. We identified the truly beneficial fruits that can replace the problematic ones: berries, avocado, papaya, kiwi, cherries, fresh coconut, and stewed pears. These alternatives not only avoid inflammation, but actively combat this process and strengthen the muscles. Finally, I shared a practical 21-day plan that has helped hundreds of my patients regain their strength and independence by eliminating harmful fruits and gradually introducing beneficial ones. The knowledge you receive today has the power to transform your quality of life. It's not just about avoiding pain or strengthening your legs. We're talking about maintaining your independence, your ability to come and go without limitations, to continue enjoying the activities you love for many years. Remember, your body changes with age, and what was healthy at 30 may not be at 60 or 70. Recognizing and respecting these changes is the first step toward truly healthy and active aging. Now, I want to make you a special invitation. Apply this knowledge to your life. Start today to reduce your consumption of problematic fruits. Observe how your body responds. Write down the changes you notice. And if possible, share your experience in the comments of this video so that others can also benefit. If you enjoyed this content and want to receive more valuable information on how to maintain your health and independence in your golden years, subscribe to the channel, turn on the notification bell, and share this video with friends and family who may be facing similar problems. Remember, the correct information is the first step to a better life. When you know what is happening to your body, you can make better decisions and regain control over your health. I'm Dr. Alexander King, and my mission is to transform scientific knowledge into quality of life for you. Until the next video.